How to use active recall for USMLE Step to CK. Are you ready to boost your study game for the United States Medical Licensing Examination Step to clinical knowledge? Let's talk about how to effectively use active recall to enhance your preparation. Active recall is a technique that encourages you to actively engage your memory instead of just passively reviewing material. This method is especially helpful for Step to CK, which emphasizes clinical reasoning and application of knowledge. To start, practice question banks like UWorld or Blueprint Prep. When you come across a clinical vignette, pause before looking at the answer choices. Try to answer the question in your mind first. This simulates the exam environment and strengthens your recall ability. After you answer, review the explanations thoroughly. Understanding why the correct answer is right and why others are wrong will deepen your learning. Next, consider using flashcards with spaced repetition. You can create your own or use pre-made decks, like those from Anki. Focus on high-yield topics relevant to Step to CK, such as diagnoses, management steps, and drug mechanisms. Make sure your flashcards prompt you to recall answers without any hints. Incorporate spaced repetition by reviewing these cards at increasing intervals. This strategy helps combat forgetting and solidifies your memory over time. Regularly update your flashcards to target weak areas identified through practice questions. Another effective approach is to integrate clinical vignettes with your recall practice. Since Step to CK tests your ability to apply knowledge, try to visualize patient presentations and management pathways when reviewing. This contextual learning will improve your ability to apply what you know during the exam. Tracking your weak areas is also essential. Use analytics from your question banks or your own records to pinpoint topics where your recall is lacking. Focus your active recall sessions on these areas by creating targeted flashcards or doing focused question sets. Testing yourself repeatedly on these subjects will help turn them into strengths. Additionally, simulate exam conditions regularly. Take timed, full-length practice exams to practice active recall under pressure. This will build your mental stamina and help you gauge which information you can recall quickly and which needs more review. Lastly, use tutor or review modes thoughtfully. Some platforms offer modes where you can attempt questions with immediate feedback. Use these to test your recall before reviewing explanations, then analyze your reasoning to reinforce your learning. By actively retrieving clinical knowledge through question practice, flashcards, and self-quizzing, combined with spaced repetition and focused review of weak topics, you can significantly improve your memory retention and clinical application skills. This approach is vital for success on the United States Medical Licensing Examination Step to clinical knowledge.